first thing is I certainly hope no one efforts to repeal health reform don't succeed. I think it would be, just when affordable coverage is within the grasp of millions of people who don't have coverage right now, any prospect of taking that away would be really tragic. And I think that repealing health reform would also hinder efforts towards cost containment, which are absolutely essential, and stifle innovation. I think I completely agree with Chris. Clearly, what I see from when I look at federal government and its implementation of health reform, the attitude very much there is full steam ahead, and that's the attitude in the Commonwealth, full steam ahead with implementation of our state reform initiative. Implementation never ends, and implementation of the national health reform initiative, full steam ahead. We at the Connector are doing a little bit of a juggling act right now. We are, on the one hand, an existing state exchange, 215,000 people plus covered through our programs, and our policy decisions affect hundreds of thousands of more folks throughout the Commonwealth. We're focused on them today. What can we do today to continue their coverage opportunities? But we're also looking ahead. We're implementing the immediate deliverables of national health reform. If you look at the plans available through the Health Connector right now, you'll see through our Commonwealth Choice plans, co-pays for preventive care that were there 6 months ago, they're gone. Opportunities for people up to 26 years of age to remain on their parents' policies, that exists right now, that didn't exist in August or July of last year. And we're also looking ahead. One of my COOs said, part of the challenge of implementation for us in Massachusetts in the Connector, notwithstanding having been a model for many elements of Massachusetts health reform, is we're driving the bus and sort of changing the wheels at the same time. We're offering coverage today, but we're planning for 2014 and the types of decisions that we have to make to refine our approach to conform to national health reform. And frankly, that's not a challenge that daunts us, that's a challenge that excites us because there are some great opportunities. I mentioned earlier that right now, if you need government assistance to purchase health care because you have trouble affording it on your own, right now in Massachusetts we have some very generous subsidies, but they stop at 300% of the poverty level, roughly $30,000 for an individual. The national health reform broadens that to 400% of the poverty level. That's going to make a groundbreaking difference in the lives of so many people throughout the Commonwealth. We have some other issues and opportunities too. Right now, through the Connector, we have one program for people who qualify for subsidies, one program for people who don't. For the most part, different health plans serving one program and then also serving the other. I think one real opportunity under national health reform is to bring it together. To look at people who qualify for subsidies, look at people who don't qualify for subsidies, offer them a wider choice of the same health plans, and also for us, take two programs and start to think about how can we refashion them to deliver coverage more efficiently. I think there are some great opportunities for us as well on that front. And as I mentioned earlier, Massachusetts led the nation in enacting an adult health coverage mandate. This is also a feature of national health reform. The rules aren't necessarily identical, very many common themes, but some differences in terms of who's subject to those rules and what the level of coverage is. But I think we feel reasonably confident that working with folks at the federal level and with the Massachusetts healthcare community, we can continue to strike the right balance and enforce and have a coverage mandate that achieves the purpose of bringing people who can afford coverage into the ranks of the insured without being unfair and spawning a backlash. I think we've been very successful to date. In terms of implementation, I think some of the most important things we see is obviously we all appreciate the federal government's HHS's and OSIO's supports for planning efforts by states. So much of the sort of game on national health reform is going to take place at the state level in terms of setting up state exchanges, expanding and reconfiguring state Medicaid programs. We all need resources in order to be able to do good planning, and we appreciate the federal government's investments to date. And I think that we all have to continue to focus on not just planning and setting up programs, but educating people about opportunities to get affordable health insurance, small businesses too, and underscoring for them the value of health insurance, and for employers and individuals and insurers and providers, and for us in government, making it very clear what each of our respective responsibilities are to deliver